Okay. So my project kind of changed as I saw the situation on the ground in India, and it ended up focusing on the history of government spending on the on rehabilitation programs. So let's begin. Bhopal is in the state of Madhya Pradesh in India, and a U.S. parent company, Union Carbide Corporation, which is now owned by Dow Chemical based here in Michigan, is actually had a plant called the Union Carbide India Limited, which produced pesticides. This pesticide in Bhopal, India. It was established in 1969. MIC is is an essential part of the production of this pesticide, and this factory was located 3 to 4 miles outside of the city center, which was then the city center. This is the factory. And on December 3rd, a little bit past midnight, 40 metric tons of MIC were released in Bhopal. And basically, this was due to lax safety regulations at the plant, which were actually anticipated by an operational survey conducted shortly before the incident. But anyway, at the time, there were 630 employees at Union Carbide and around 900,000 people living in Bhopal. Right now, it's about 1.5 million. The death toll ranges. On the first night, the government's official estimate was 2,260 people died on the first night of the disaster. And then the estimates for the total number of deaths over the week following the disaster was about 20,000. And then the injuries, almost 500,000 people were, actually over 500,000 people were exposed to the gas on the first night. And there were many injuries, as you can see, and it's counted as the worst disaster in the history of mankind. So my project was focusing on the government spending on rehabilitation programs after the disaster. Actually, this is a picture of the factory right now. The way it stands, it was never fully cleaned up. It's very eerie, actually. So there's most activists in the area will tell you that Bhopal actually went through 2 disasters. So the first night when the gas was released was obviously a disaster. The second disaster is really because of the lack of cleanup. Hazardous waste seeped into the groundwater, and the surrounding communities continue to drink that water. Only about 68% of the people living in surrounding areas still don't have access to clean water. Greenpeace conducted a study showing that these chemicals were in that water. Also, because the land was cheap, a lot of busties or slums emerged around the factory shortly after the disaster. Even to this day, you have children playing outside. It's very eerie. Again, this is a picture of a busty. Sambhavna Trust, which actually Rachel will talk about later because we both ended up going to the same NGO. But Sambhavna Trust is a clinic that offers many different types of treatments, including Western medicine, but also Ayurvedic and homeopathic medicine to gas victims for free. And it also is a main repository of research. So I did a project. My project is going to be added to their sort of database because they give volunteers. And I was volunteering for them as well while doing my research. So this is a picture of the clinic. You can see they have solar power generators, and you can see the herb garden in the back. Okay, so the research background, Western media kind of stops at the Empowered Commission in August of 2008. Activists basically were pushing the Indian government to establish this Empowered Commission instead of letting the Madhya Pradesh state government be in charge of the rehabilitation efforts after the disaster. And when I got to the ground, I realized that the Empowered Commission was never actually established because although after months of protests and hunger strikes, the government in August 2008 promised to establish this commission of activists. The Madhya Pradesh state government intervened by proposing a plan of action for rehabilitation. And that's been under debate ever since, and the commission was never actually established. So my objective was to kind of compare the effectiveness of past government spending with the proposed commission to kind of see what what the differences were between what the state government would be doing and what the empowered commission would be doing. So that took a lot of looking at, the government's action plan. So basically, I did a lot of background interviews just for, my own knowledge, and then mostly was based on document analysis. So the administrative setup of the government spending was basically there's a gas relief and rehabilitation department established in 1985, and then a directorate of gas relief and rehabilitation established in 1995. And then the major areas of rehabilitation were medical, social, economic, and environmental. So I'm going to just go into I'm just going to run through each one of those sort of. So medical rehabilitation, you have all these hospitals and centers established, but activists were saying, well, the system didn't lead to any significant improvements, and there was a monitoring committee established in 2004 that kind of shows that. And so this kind of shows that there's a big disparity between the criticisms that the monitoring committee puts forth and what the action plan was proposing. So on the monitoring committee side, you have inadequate patient records, you have a lack of staff, lack of medical protocol, just general mistreatment of patients. A lot of patients were complaining that they weren't actually getting physically examined by doctors who were more eager to treat private patients. And then on the other hand, the government action plan doesn't really address any of those issues, and it wants to build more infrastructure. I actually visited some of these websites and found, whole sections of hospitals just full of cobwebs and completely underutilized. Actually, they say about 80% of the specialist positions were vacant and 30% of the doctor positions were vacant. So really a big understaffing problem that wasn't being addressed by the plan of action. And this kind of breaks down the spending that was proposed. So lots of money at stake here. And these charts kind of show, as you can see here, big portion of the equipment going to one hospital, and actually the detailed plans list equipment that doesn't actually exist. It's just pretty funny. Social rehabilitation. So on the completed and ongoing side, you have widow pensions, the building of schools, and the criticism was really that, these schools were getting built and nobody was staffing them, they weren't being maintained, or that the Department of Education was maintaining them, so the state government doesn't really need any more money to maintain them, and that housing was inadequate. Oh, and also the housing was built on the areas where there's contaminated water. So again, here you have the government propositions and then the criticism of each one. Just underutilization of facilities is really the main theme here. And then, the widow pension, we don't really know where this number 5,000 widows comes from, etc. Then the economic rehabilitation, basically the government sets up all these industrial sheds and training facilities so that people can theoretically get employment. But the criticisms of all these things is that nobody actually does get employed from them, and then a lot of these sheds don't actually come about. So the records don't really match the situation on the ground. You go to a lot of where the industrial sheds should be according to government records, and there's nothing there. Very small fraction of people were actually employed based on these programs. And then you have this is the spending projections. It's huge amounts of money, not necessarily clear where it would be going. I figured at this point we'd all be bored, so I put a picture in. 1 more minute? 2 more minutes? Okay, sorry. Environmental rehabilitation. Lots of building of parks, and above all, remembrance. And then the really funny part here is that the government, up until publishing this plan of action in 2008, was denying the existence of chemicals in any groundwater until they published a plan of action that says, well, the groundwater is really bad and we need this much money to fix it, which was just hilarious to all the activists. But you can see kind of a lot of park building, and the criticisms are that, you don't really need parks as much as you need the factory to be cleaned up and the water to be decontaminated. Again, that statistic, about 68% of people. I actually tasted the water in this area, and it was fairly horrific. So environmental rehabilitation, this is the spending projections. You can see this is a Bhopal Memorial. These kids were great. More Bhopal Memorial. Again. Okay, so the conclusions really that, are kind of obvious from the findings that I presented. The Empowered Commission would be sort of more grounded in the understanding of gas victim needs, that government programs sort of needed major reform in what was already there and did not necessarily need more infrastructure. And that, there's a lot of non-transparency on part of the state government. And the central government really was also issuing criticisms and unwilling to spend any more money on it. So, okay. And that's actually it. Thank you.